Following another controversy this morning tied to a potentially life-saving transplant.
That's right, Matt. Well, a Georgia teenager is in desperate need of a heart transplant, but his mother claims the very people who could save her son's life are getting in the way.
4 weeks ago, 15-year-old Anthony Stokes checked into Children's Healthcare in Atlanta with shortness of breath and chest pains. Today, he's dealing with the reality that he may only have months left to live. The teen needs a new heart, but the boy's mother, Malencia Hamilton, says the hospital won't even put his name on the transplant list. Hamilton provided a letter to NBC News saying Anthony is not a transplant candidate due to having a history of noncompliance. In medical terms, noncompliance means a patient is unable or unwilling to follow through with a medical regimen. For example, failing to take prescribed medications or missing doctor's appointments. But Anthony's mother says that her son had no history of illness, and she believes that he is being punished by the hospital for run-ins with the law. He was under house arrest and wearing an ankle monitor when he was admitted to the hospital, punishment for a recent fight.
He's a young boy. You know, he gonna make mistakes, but I think he still deserves a second chance.
The hospital told us it can't discuss the case because of patient privacy law, but they did release a statement saying, "The well-being of our patients is always our first priority. We are continuing to work with his family and looking at all options regarding this patient's health care. We follow very specific criteria in determining eligibility for a transplant of any kind." His mother fears that without a new heart, her son could be in for the ultimate punishment.
I just pray. I pray constantly.
Let us bring in Dr. Nisa Goldberg, a cardiologist and medical director of the Women's Heart Program at New York University's Langone Medical Center. Dr. Goldberg, good morning to you. When we hear noncompliance, denied a transplant because of noncompliance, is there one set of guidelines for all of these transplants?
There is one set of guidelines for all transplants. First, it's medical, to make sure the person is healthy enough, that they have good functioning kidneys, a normally functioning liver, don't have alcohol or drug abuse, and are healthy enough to go through the procedure. The procedure, we have the technology to do the procedure. That can be done pretty easily. All you need is a heart.
But then when you hear this family say they're concerned that perhaps this is something other than about a medical concern, this could be because of run-ins with the law, is that something that the board overseeing a transplant would consider?
Not necessarily the fact that the person has been in trouble with the law, but we do worry about people who fail to be compliant or are able to follow through the program after transplant.
But if you have had run-ins with the law, would that place you in a lower spot on the transplant list?
Not necessarily. What places you on a lower part of the transplant list is evidence that you haven't followed through with taking your medications in the past. Research has shown is if you fail to take your heart failure medications before the transplant, you're unlikely to take them after.
This is life and death for a patient. This is the world for that patient's family. If they feel they have been judged wrongly in this and that they haven't been given the right consideration, what avenues are left open to them?
I think there has to be better communication between the medical personnel and the family. Certainly they can always go for a second opinion at another
Can they
heart
appeal the
failure
decision?
center. They could appeal the decision to the ethics committee of the hospital, and that could be decided with the ethics committee of the hospital. It sounds like the one thing this young man has going for him is a really committed family, and that also counts with someone who's on the transplant list.
All right, Dr. Nisa Goldberg. Doctor, thanks very much. I appreciate your input.